for a lot of different eras. People have attempted to train people in teams. And so in many ways, it's not a new problem. But it's really been in the last probably 10 years that the term interprofessional education has taken off. By training health professionals early together, we hope that actually they build and become a collaborative practice-ready workforce. So VPIL puts 4 students representing medicine, nursing, pharmacy, and social work on a team, and we put them in a clinical setting 1/2 day a week. And as I tell a lot of the students, they become better professionals when they understand how the others are thinking.
So on a typical day, we'll go in as a team and interview a patient. We'll each ask questions, kind of get a feel for what's going on with the patient. And after our meeting with the patient, we'll look at it from 4 different viewpoints. And what's really cool is we'll each pick up on different things that the other students hadn't noticed.
We went to visit a patient that was seen at our clinic, and we all interviewed her together and then came up with assessments for what we think should be done with this patient. And I remember Natasha came up with something called an eco map. It represents that patient's, the things that positively influence them and things negatively influencing them.
Environment,
yeah. And that was really when I saw, okay, you are thinking differently from me.
VPIL is like a scrimmage because we're able to get together and flesh out different plays and really get into the nitty-gritty of what it looks like to practice together in real-life clinical situations. And that scrimmage time, that practice time where mistakes are okay and where there is time for self-reflection and regrouping and trying again each Wednesday afternoon is invaluable.
I'm getting to experience taking patient histories and getting to witness nurse practitioners and physicians do physical assessments and coming to clinical conclusions about what's happening. All of those things give me a much deeper and broader experience than I think I would have gotten otherwise.
We actually visited one of our patients at home within our center, and we were asked to sort of do a needs assessment. So as a medical student at this stage of my career, I have no idea how to basically do any of that, either the plan or the assessment, doing sort of full evaluation of the patient. But watching Christine work, how she worked through different dietary changes or different exercise changes was very enlightening for me.
That's nice.
I think we get trained in our specific fields and we get very comfortable doing what we do and knowing what we do and disregarding other people. I imagine it would have been very awkward to go out as a resident and say, what do you do again? I don't really know. So it felt to me much more comfortable to learn from other students.